Seniors, over 60, take these 3 vitamins for stronger legs, fast. It's a common experience for many individuals past the age of 60, a subtle but noticeable weakening in the legs, making everyday actions like rising from a chair a concerted effort that might even require pushing off with your knees. Even simple activities like walking across the living room can become precarious, with a disconcerting loss of equilibrium. Stair climbing, once an effortless act, now feels akin to lifting weights. While many might dismiss these changes as an inevitable consequence of aging, the reality is often more specific and, thankfully, more manageable. This gradual decline in leg strength is frequently one of the earliest and quietest indicators of age-related muscle loss, a condition known as sarcopenia. This insidious process unfolds without fanfare, without pain or swelling, until one day the need for assistance becomes undeniable. The good news, however, is profoundly encouraging. Scientific evidence has shown that leg strength can be significantly restored in a matter of mere days, and remarkably, with the help of just 3 crucial vitamins. This is not about grueling exercise routines or expensive therapies. It's about providing your body with the ideal nutrients at the precise moments it needs them. This comprehensive exploration will delve into the 3 essential vitamins that every senior needs, illuminating how deficiencies in these vital nutrients can lead to weak, heavy legs, and outlining how to safely and effectively combine them for a swift recovery. This information is grounded not in fleeting health fads or anecdotal hearsay, but in robust clinical investigations, actual scientific research, and decades of accumulated professional experience. Stick with us until the very end, as we will also reveal a specific vitamin regimen that, while often overlooked, proves exceptionally effective. As we move past the milestone of 60 years, our bodies undergo a gradual yet discernible transformation. Our bones can become more brittle, susceptible to fractures, and our circulatory system begins to operate at a slower pace. Concurrently, our muscles, particularly those that power our legs, start to diminish in strength and mass. This weakening is often so subtle that many individuals remain unaware of its progression, even as simple actions like standing up or walking become increasingly challenging. Alarmingly, according to the American Geriatric Society, adults over 60 can lose between 1 to 3% of their muscle mass annually. This translates to a potential loss of up to 15% of leg strength within a mere 5-year span, often without conscious awareness. The reasons behind this age-related muscle decline are multifaceted, but 3 primary culprits stand out. Firstly, as we age, our digestive systems become less efficient at absorbing nutrients, and our stomachs produce less acid, a crucial component for nutrient extraction. This leads to deficiencies in vital vitamins such as D, B12, and thiamine, all of which are indispensable for proper nerve transmission and muscle contraction. Secondly, poor blood circulation plays a significant role. When blood flow slows, our legs receive a diminished supply of oxygen and essential nutrients, resulting in early fatigue, frequent cramping, and that characteristic heavy, tired sensation in the legs. The third contributing factor is a decrease in physical activity, as elderly individuals tend to walk less or avoid challenging movements like climbing stairs. Their leg muscles inevitably weaken and atrophy. Furthermore, even with consistent movement, muscles cannot adequately regenerate and rebuild without the correct nutritional support. The remarkable news is that by diligently addressing these 3 key vitamin deficiencies, you can reclaim your leg strength within a matter of days. Let's now examine each vitamin in detail, uncovering its unique role and how it functions to restore vitality. Vitamin D3, the master switch for leg strength. The veritable switch that reactivates leg strength for many seniors is vitamin D3. Far from being just another nutrient, vitamin D3 acts more like a master switch, re-energizing your entire neurological, skeletal, and muscular system. The problem arises because our body's inherent ability to synthesize this vital nutrient significantly diminishes after the age of 60. our skin thins, and the efficiency of our liver, kidneys, and overall conversion process for vitamin D slows down. Coupled with reduced sun exposure, this decline prompts our body to begin shutting down critical systems, leading to muscle weakness, heavy legs, slower movement, and, most concerningly, a loss of equilibrium. This subtle deficiency in vitamin D3, a fundamental requirement for our physical well-being, can render us unsteady and vulnerable. So, what makes vitamin D3 so critically important? While its role in calcium absorption, essential for strong bones, is well known, its influence extends much further. Vitamin D3 ensures that our muscle fibers contract correctly, facilitates the smooth transmission of signals by our nerves, and crucially combats muscle atrophy, that silent but persistent weakening that accompanies aging. Without adequate D3 levels, our bodies become unreliable and frail, much like an aging machine struggling to perform its functions. How can you identify a potential vitamin D3 deficiency? Key signs include weakness in the legs, especially noticeable when climbing stairs, fatigue that sets in quickly from standing or walking, nighttime leg cramps, difficulty turning or stepping swiftly, and significant pain in the hips, knees, or heels. Some individuals may also experience mild anxiety, impatience, and trouble falling asleep. These seemingly minor symptoms are, in fact, early indicators of vitamin D3 inadequacy, often mistakenly attributed to the general effects of aging. The scientific consensus strongly supports the impact of vitamin D3. For instance, a study conducted by the University of Birmingham in the United Kingdom observed individuals over 65 who consumed 800 IU of vitamin D3 daily. Astonishingly, their leg strength increased by an average of 19% within just a few weeks. Another study from China revealed that seniors who took a D3 supplement alongside minimal exercise demonstrated considerable improvements in both leg power and balance. Furthermore, researchers at Harvard's Geriatric Research Center found that older adults with low vitamin D3 levels were a staggering 40% more likely to experience falls or require hospital admission compared to those with normal levels. The message is clear: vitamin D3 is not just crucial for bone structure, it is a guardian of your independence. Upon restoring optimal D3 levels, your body benefits immensely. It absorbs calcium more efficiently, promotes the growth of new muscle fibers, enhances muscle contraction and response time, reduces latent inflammation within muscle tissue, and facilitates smoother, more painless movement. Simply put, vitamin D3 reawakens your joints and muscles. The recommended dosage for healthy individuals over 60 is generally between 800 to 1,000 international units, IU, daily. For those with a history of falls or exhibiting clear signs of frailty, a daily intake of 1,500 to 2,000 IU is advised, always under medical supervision. For optimal absorption, vitamin D3 should be taken in the morning or early afternoon, always after a meal that includes healthy fats such as salmon, eggs, or olive oil. It is crucial to avoid taking D3 immediately before bedtime, as it can disrupt sleep patterns. Can dietary sources alone suffice? Regrettably, achieving adequate D3 levels solely through diet is challenging. For context, a 100-gram meal of fatty fish might contain around 500 IU, a single egg provides about 40 IU, and a glass of fortified milk offers approximately 100 IU. It is highly impractical for most seniors to consistently consume sufficient quantities of fatty fish, eggs, and milk daily to meet the recommended 1,000 IU. Therefore, vitamin D3 supplementation is often a necessary and effective strategy. Who should give serious consideration to supplementation? If you are over 60, spend limited time outdoors, feel unsteady or have a history of falls, have been diagnosed with osteoporosis or experience joint pain, or follow a predominantly plant-based diet, low in dairy and fish, vitamin D3 supplementation should be a top priority. A few critical caveats are in order. While D3 is generally safe, excessive intake over prolonged periods can lead to adverse effects. Consuming more than 4,000 IU daily without medical guidance can result result in headaches, constipation, nausea, kidney stones due to elevated calcium levels, or even irregular heartbeats in susceptible individuals. The key lies in adhering to the appropriate dosage, timing, and maintaining regular monitoring of your levels. Vitamin D3 is instrumental in helping older adults restore leg strength. It reactivates those subtle, time-slowed muscle systems. When taken correctly, you can anticipate noticeable improvements within days, including stronger legs, a lighter step, and renewed confidence in every movement. Vitamin B12, the guardian of nerve, health, and leg confidence. Restoring balance, nerve health, and leg confidence hinges on the often overlooked vitamin B12. While known for its benefits to memory and overall vitality, many are unaware of vitamin B12's critical role in facilitating communication between the brain and our muscles, particularly in the legs. It is the linchpin for maintaining healthy nerves, coordinated movements, and swift reflexes. When B12 levels decline, the neural pathways between the brain and muscles become compromised, and it is often in the lower extremities that the initial symptoms manifest. What are the consequences of insufficient B12? You might experience symptoms such as burning, tingling, or numbness in your feet, weakness in your legs, especially when standing or walking, a sensation that your legs are not responding or are asleep, difficulty maintaining balance even on stable ground, or a feeling of unsteadiness that necessitates assistance when walking. If your B12 levels are below optimal, these sensations can become more pronounced. Beyond the physical, some individuals also report mood swings, mild sadness, forgetfulness, and a general brain fog. These symptoms often develop gradually, leading many seniors to believe they are simply a natural part of aging, when in reality they are classic signs of a B12 deficiency. Why is deficiency so prevalent among older adults? Two primary factors contribute to this. Firstly, inadequate absorption. As we age, our stomach acid production decreases, particularly if we are taking medications that suppress stomach acid, such as ranitidine or omeprazole. In this low-acid environment, it becomes more challenging to extract B12 from our food. Secondly, dietary restrictions. Meat, fish, eggs, and dairy products are the primary natural sources of vitamin B12. If your diet is low in these animal products, or if you consume a predominantly plant-based diet, your body may not absorb sufficient amounts, even if your intake is theoretically adequate. This explains the high incidence of B12 deficiency in individuals over 60. The scientific evidence unequivocally highlights the impact of B12 deficiency on the mobility of older adults. A study from Oxford University in the UK found that individuals aged 65 and older with low B12 levels walked more slowly, had significantly poorer balance, and were more than twice as likely to fall in the following year compared to those with normal levels. In another randomized clinical trial published in the Journal of Gerontology, seniors received 1 to 2 milligrams of vitamin B12 daily for 8 weeks. Following supplementation, participants reported reduced numbness and instability, improved lower body strength, and faster reaction times. Beyond enhancing cognitive clarity, B12 is fundamental in maintaining your body's balance and control. How does vitamin B12 function within the body? It is crucial for the formation of the myelin sheath, the protective insulating layer that surrounds our nerves. This sheath is essential for efficient nerve signal transmission. Vitamin B12 also supports red blood cell production, ensuring optimal oxygen delivery to muscle tissues, facilitates energy, metabolism, and enables the quick and precise relay of signals from the brain to the muscles. This ensures that muscles receive the energy they need to function effectively. When you are deficient in B12, nerve function is impaired, muscles misinterpret commands, and your legs begin to feel disconnected. Who is most likely to experience B12 deficiency? If you are over 60, regularly use antacids or acid-blocking medications, follow a low-meat or vegetarian diet, take metformin for diabetes, suffer from digestive disorders like gastritis or IBS, consume alcohol regularly, or have undergone weight reduction or gastrointestinal surgery, you are at a higher risk. In such cases, a simple blood test to determine your B12 levels is highly recommended. It's important to be aware of often overlooked indicators. Some individuals might not experience the typical tingling or numbness. Instead, they may become clumsy, drop objects frequently, experience minor headaches, persistent fatigue unrelieved by rest, or intermittent pain or buzzing sensations in their feet. These are all warning signs that your body is attempting to communicate a deficiency. Prompt action can lead to a quicker recovery. The recommended daily dosage of vitamin B12 for individuals over 60 is a safe and effective 500 to 1,000 micrograms (mcg) of methylcobalamin. Methylcobalamin is the active form of B12, meaning your body can utilize it immediately without the conversion process, which is particularly beneficial as conversion rates decrease with age. It is available in various forms, including chewables, sprays, and sublingual tablets that dissolve under the tongue. To avoid potential interference with absorption, it is best taken in the morning or with lunch, as coffee and tea can hinder its uptake. Can dietary intake alone provide sufficient B12? In principle, yes, but in reality, it is highly improbable for most seniors. Consider the typical B12 content in common foods. 3 ounces of beef liver contain around 70 mcg, 3 ounces of salmon provide about 4.5 mcg, 1 large egg offers merely 0.5 mcg, and 1 cup of milk contains around 1 mcg. To meet your daily requirements solely from food would necessitate consuming substantial quantities of fish, dairy, or liver every day. Therefore, a supplement often presents the more practical and reliable choice for the majority of seniors. Is vitamin B12 safe? Yes, B12 is water-soluble, meaning any excess is readily flushed out of your body. Even at high dosages, it is exceptionally safe for healthy individuals, with no known toxic level. However, if you are on blood thinners or have chronic kidney problems, it is advisable to consult your doctor. Otherwise, B12 supplements are among the safest and most effective ways to boost energy, improve nerve function, and regain control over your legs. Real-life testimonials abound, with many older individuals reporting feeling more stable when walking, regaining sensation in their feet, standing up with greater confidence, and even experiencing better sleep once their nerve-related symptoms subside. Vitamin B12 is not just a brain vitamin, it's a movement vitamin. It reestablishes the vital connection between your body and brain, making your legs feel stronger, your muscles react more quickly, and your confidence return as those neural pathways are cleared. If you've been experiencing unusual sensations, limb weakness, or balance issues, don't disregard the potential of B12. Give your nerves the support they've been longing for. Vitamin bone, thiamine, the secret to anti-fatigue and muscle. Energy. While vitamin D3 might be recognized for muscle building and vitamin B12 for nerve-to-leg communication, the puzzle of leg strength still has one more crucial piece: thiamine, also known as vitamin bone. This vitamin provides the very electricity, the raw energy, that your muscles need to function. If D3 turns on the lights and B12 connects the wires, your muscles simply cannot operate without energy. And without vitamin bone, your body runs out of fuel, even if your bones are strong and your nerves are sharp. What exactly is vitamin bone, and why is it so vital? Thiamine is fundamental to energy metabolism. This means it plays a key role in converting food, particularly carbohydrates, into ATP, adenosine triphosphate, which is usable energy. Every movement, every breath, every muscular contraction is powered by ATP. Given that your legs contain the largest muscles in your body, they require a constant and ample supply of this energy. When your vitamin bone levels are low, your muscles feel heavy, fatigue easily, and struggle to recover from any exertion. What are the signs of a potential vitamin bone deficiency? Many individuals over 60 report experiencing these early symptoms, even with minimal activity: legs feeling weak or excessively tired, cramping in the muscles, especially in the feet or calves, a dragging, heavy sensation when moving, experiencing shortness of breath while ascending stairs, occasional lightheadedness or fatigue upon standing, and a general mental exhaustion. A lack of appetite and an overall diminished drive to move can also be indicative. These are typical signs of a slowed muscle metabolism, and vitamin bone often plays a significant role. What causes vitamin bone deficiency in the elderly? Several factors contribute. 1. Reduced absorption. The digestive system's capacity to absorb thiamine from food diminishes with age. 2. Medication use. Diuretics, commonly prescribed for heart conditions or high blood pressure, can lead to the flushing of thiamine from the body through urine. Antibiotics and metformin can also impact thiamine levels. 3. Alcohol consumption. Even moderate alcohol intake, such as wine or beer, can hinder the body's ability to absorb thiamine. 4. Poor diet. Thiamine is often stripped from processed foods. Additionally, intake can be insufficient if you consume fewer whole grains or legumes. What does the research indicate? A 2021 study from Tokyo University found that over 30% of 300 older participants exhibited low thiamine levels. These individuals also demonstrated significantly less leg strength, slower movement speeds, and frequently complained of muscle weariness. Following thiamine supplementation, most showed a noticeable increase in energy, walking distance, and stair climbing ability. Another study in the Journal of Neurological Sciences reported that patients with persistent leg fatigue who received 100 milligrams of thiamine daily experienced improved endurance within 7 days, 82% of participants, and reduced leg heaviness and pain, 68% of participants. Crucially, no adverse effects were observed. In what ways does vitamin bone support your legs? Thiamine powers the Krebs cycle, your body's primary energy-producing pathway. This enables your muscle cells to generate ATP more rapidly, recover more quickly from movements, and maintain their strength and tone throughout the day. Furthermore, thiamine facilitates the transmission of nerve signals, particularly in the peripheral nerves that govern your legs and feet. It's akin to trying to operate a car without fuel. When you lack vitamin bone, nothing moves, even if all other systems are functioning. What is the recommended dosage of vitamin bone? The general recommended daily allowance is 1.2 milligrams for men and 1.1 milligram for women. However, significantly higher doses are often employed for therapeutic benefits in older adults experiencing symptoms. Doctors frequently advise seniors with nerve issues, fatigue, or leg weakness to take 50 to 100 milligrams daily. The good news is that thiamine is water-soluble, so any excess can be safely eliminated through urine. When and how should it be taken? Consuming vitamin bone in the morning can help boost energy levels throughout the day. It should always be taken with food, preferably a meal that includes some healthy fat or protein. Avoid taking it with alcohol, coffee, or black tea, as these can interfere with absorption. Can vitamin bone be obtained through diet alone? Yes, but it requires deliberate effort. Excellent dietary sources include whole grains like brown rice and oats, legumes such as beans and lentils, sunflower seeds, and organ meats and pork. However, most seniors do not consume enough of these foods daily, and certain medical conditions or medications can impede absorption. Therefore, a supplement can be a more reliable option. Who should consider taking vitamin bone supplements? If you have type 2 diabetes, consume alcohol regularly, take diuretics, metformin, or acid-blocking drugs, experience leg fatigue even with light exertion, or have had unexplained weight loss or loss of appetite, your thiamine levels should be checked or simply replenished with a safe daily dose. Is it safe? Yes, thiamine is known to be safe, even at higher dosages, and is considered one of the safest supplements for seniors. However, before starting high-dose thiamine, it is always best to consult your physician, especially if you are on medication or have liver or kidney issues. Real-world outcomes are compelling. Many seniors report feeling significantly more energized after just 3 to 5 days of taking vitamin bone. Their legs feel lighter, walking becomes easier, climbing stairs is less taxing, and the desire to be active and move returns naturally. It's like adding fuel to an engine that has been sputtering for years. While vitamin B may not receive the same spotlight as D3 or B12, it can be the crucial component that makes all the difference for older adults experiencing energy problems, muscle weariness, or leg heaviness. It powers your muscles, restores your drive, and provides the energy, purpose, and ease to navigate your day. If you feel tired, weighed down, or disconnected from your body, don't overlook vitamin bone. The simplest nutrients can often have the most profound impact. Combining these 3 vitamins for optimal results. Now that you understand the individual ways vitamin D3, vitamin B12, and thiamine, vitamin bone, support your muscles, the next logical question is how to best combine these nutrients for optimal benefit. The key to success lies in timing and simplicity. Let's begin with the ideal timing for each vitamin. Vitamin D3. The best time to take vitamin D3 is in the morning, immediately after breakfast. This is particularly true if your breakfast includes a healthy, fat-rich meal, such as yogurt, eggs, or a small amount of avocado. Vitamin D3 is fat-soluble, meaning it requires fat for effective absorption. Vitamin B12. Vitamin B12 is most effective when taken in the early afternoon or around midday. Since B12 can also promote alertness, taking it too late in the day may interfere with sleep. It's also important to note that tea and coffee can hinder B12 absorption, so it's best to avoid consuming these beverages at the same time. Vitamin bone, thiamine. Your morning fuel is vitamin bone. Consume it with your first meal of the day, ideally a healthy breakfast that includes whole grains and some protein. This will support your energy levels throughout the day and even aid in focus. Here is a simple daily illustration of how to integrate these vitamins. Breakfast: a small bowl of Greek yogurt, 1 boiled egg, 1 vitamin D3 capsule, and 1 vitamin bone tablet. Lunch: steamed vegetables, grilled salmon or tofu, and 1 vitamin B12 tablet or lozenge. With this regimen, your body receives the proper nutrients in the right amounts at the opportune times. What about taking a multivitamin? If you currently take a multivitamin, carefully read its label. Many senior-focused formulas may underdose these crucial nutrients, so ensure it contains adequate quantities of vitamin bone, B12, and D3. Remember that some multivitamins contain both water-soluble and fat-soluble vitamins. Therefore, it is still advisable to take them with meals, preferably at lunch or in the morning, and never on an empty stomach. Finally, it's important to remember that more is not always better. Always consult your doctor or pharmacist and take medications as prescribed, especially if you have a chronic illness or are on other medications. When taken as directed, these 3 vitamins work synergistically like a well-oiled machine, helping to restore strength, balance, and vitality to your legs and, by extension, your life. Safety advice and cautions. When using vitamins. Like any powerful tool, vitamins are effective at reviving health and vitality, but they must be used with care and knowledge. Here are some crucial safety precautions to keep in mind, particularly if you are over 60. 1. Avoid self-adjusting dosage. It does not follow that more is always better simply because something is natural. You will not achieve faster results by taking twice or 3 times the prescribed dose. In fact, it could be harmful. For instance, vitamin D3 is fat-soluble, and prolonged intake of over 4,000 IU daily without supervision can lead to excessively high calcium levels. This can manifest as kidney stones, constipation, nausea, or even disorientation. 2. Caution with kidney or liver issues. These organs are responsible for metabolizing and eliminating excess vitamins from your body. Even standard dosages can accumulate and lead to adverse effects if your kidneys or liver are not functioning optimally. Therefore, before commencing any supplement regimen, especially fat-soluble ones like D3, consult your doctor if you have been diagnosed with chronic kidney disease, fatty liver, or any other serious ailment. 3. Be aware of subtle side effects. It's easy to overlook certain adverse reactions. For example, while rare, taking very high doses of vitamin B6 for extended periods can lead to tingling or numbness in the hands and feet. Unmonitored misuse is a common culprit before more serious issues arise. Excessive vitamin D3 can cause headaches, muscle cramping, or a poor appetite. Always be vigilant for any slight changes in your mood or physical sensations, especially after starting a new vitamin. 4. Get your blood levels measured. If you are taking D3 or B12 long-term, consider getting a basic blood test every 6 to 12 months. This simple measure can ensure you are not inadvertently taking too much or too little, and that your levels are within the safe and effective range. In conclusion, while vitamins can undoubtedly enhance your quality of life, the secret lies in being wise, informed, and cautious, especially as we age. These 3 straightforward nutrients possess the power to transform your strength, mobility, and independence when taken as directed. Let's briefly review. What you're experiencing with your legs is not necessarily just age, not just your imagination, and most importantly, it is not irreversible. If your legs have been feeling unsteady, heavy, or weak lately, we've explored how vitamin B12 can enhance your nerves and balance, vitamin D3 fortifies your bones and muscles, and thiamine replenishes your energy and stamina. These 3 basic vitamins work in concert as a potent trio, capable of helping you regain your strength, confidence, and freedom of movement. The key, however, is taking the first step, whether it's monitoring your blood levels, taking a morning supplement, or consulting your doctor. Action, not waiting, is always preferable. We would love to hear from you immediately. Have you tried any of these vitamins before? Did you notice a difference in your overall energy, strength, or balance? We grow stronger together as we learn from one another, so please share your experiences in the comments section below. Thank you for watching. Take care of your body, fuel your legs, and keep moving forward, one powerful stride at a time.